So I'm going to move on now and invite Dr. Stephen Hoffman. I'm going to give a little introduction and then ask him to speak. And he's going to take us up to that global perspective that Dr. Tam talked about. So Dr. Stephen Hoffman holds several important and distinguished roles here in Canada and internationally. Dr. Hoffman is the Dolly Distinguished Chair in Global Governance and Legal Epidemiology. So very interesting, some of Theresa Tam's points around leadership and governance, and also the use of data and the collection of data. He's a professor of global health, law, and political science at York University, and he's the director of the Global Strategy Lab and the director of the World Health Organization's Collaborating Center on Global Governance of Antimicrobial Resistance. However, Stephen is here with us today as the scientific director of the Institute of Population and Public Health at the Canadian Institutes of Health Research. And Stephen is going to speak to the UN research roadmap for the COVID-19 recovery, leveraging the power of science for a more equitable, resilient, and sustainable future. So very much aligned with what Dr. Tam just spoke about. And what's interesting here is this is a document that he was invited to lead the development of by the United Nations Deputy Secretary General. And the UN research roadmap, and it was released in November 2020. Remember that the Chief's report was released in October of 2020. It provides a global guide to how science can inform a more equitable, resilient, and sustainable recovery from COVID-19. And CIHR coordinated the participatory process, and I understand, Stephen, it was over 10 weeks, which, as Theresa Tam alluded to, much has changed very rapidly. Things that many of us have talked about for 20 years occurred over a period of probably 20 days early in the pandemic. So you had 10 weeks to do this extensive participatory process. But it was also part of Canada's support to the UN comprehensive response to COVID-19. And the intent, of course, is to save lives, protect societies, and to recover better. And in our first series of conversations, we heard about having a goal of back to better, and that was in April. So it certainly aligns with what we heard in April. And I'm going to read the following quote from the UN Deputy Secretary General in her introductory message to the report, because I think it speaks to what we're here today to think about and to learn about. This roadmap is a tool that can be used by researchers, by research funding agencies, by civil society organizations, by governments and international institutions. And I'm going to say by future leaders. I was watching the chat there, and we've got an awful lot of students with us today. So leaders now and leaders into the future. To build partnerships, to align research response efforts, and to demonstrate the power of global science. And recovering better means improving the lives of the most vulnerable. If recovery efforts do not seek to include the most marginalized, we will fail to build a better world than we had at the outset of the pandemic. So back to what Theresa said as her bottom line, no one is protected until everyone is protected. So over to you, Stephen, to give us a presentation, and then we're going to come back to some questions that you had submitted upon registration. So welcome, and thank you for being here today.
Great. First, Dr. Boettger, thank you very much to you for this invitation, and to your whole team at the National Collaborating Center and Determinants of Health for bringing this together. Very much appreciated. Also, I just wanted to congratulate Dr. Tam, the entire office of the Chief Public Health Officer. I think that the report that Dr. Tam just described is really a landmark report in the sense that not only is it so helpful in guiding us through the current pandemic, but the thinking about that next stage, about what we do afterwards, making sure that we can recover better, recover forward, is going to be so important. And thinking of the context in which that was written earlier in this pandemic, when everyone was so busy in managing the day-to-day dimensions of this pandemic, bringing that forward at that time, I think, was a rather heroic effort from Dr. Tam and her entire office, with whom she has that support. So congratulations. Today, in talking about the UN Research Roadmap, I'm going to be very brief because I think the most interesting part of this webinar will be that conversation with all of you afterwards. But I wanted to just highlight that the place in which this roadmap is coming from is a very similar place as to the starting point for the CPHO report about which we just heard. And indeed, there's lots of similarities. There's also some differences, but I'm happy to walk through some of that in just a few minutes, and then we can have that conversation. So hoping that everyone can see my slides, I will just flag that, at least from a global perspective, it's clear that there's been far-reaching impacts of this pandemic. First, what's clear is that this is not just a pandemic of a virus. Of course it is also that, but it is also a pandemic of socioeconomic consequences and a pandemic of inequities. And as a result, when responding to this pandemic and when trying to think about ways of getting out of it in a better place, we need to think about it in that broader context of what this pandemic actually means for all of us living on this tiny blue dot in the universe. And so the global statistics are quite clear. This has not been last year was not a very good year for human development. 2021 is on track to also not be a good year. But if you just look on the slide, so 71 million people pushed into extreme poverty in 2020. At some point, 90% of kids around the world were out of school. Some countries have reported increases in domestic violence by up to 30%. Numbers which in some cases are likely to be underestimates. And then from a prison overcrowding perspective, 60% of countries right now are reporting prison overcrowding, which of course is not good at any time, but particularly not good in the context of an infectious disease pandemic. And so in that respect, both this UN research roadmap, which I'll describe in a second, and the report from Dr. Tam is really about looking towards a better recovery, a more equitable recovery, a more resilient recovery, and a more sustainable recovery. Different dimensions, of course, in which we can think about these things, but there's just remarkable overlap and similarity between these two efforts. Maybe there's something Canadian about framing things in various ways, but I think what's really interesting is that in our process in the UN, which was very participatory, we engaged people from, it was over 25 countries, were actively involved through various different agencies, even more widely engagement through virtual consultations, which engaged many people from many additional countries. And as a result, in thinking through that, what was clear is that as much as our world is facing different challenges, we're also actually facing remarkably similar challenges. And equity very much comes to the fore of those issues. This is a problem in the richest societies. It's a big problem in resource poorer societies. So in terms of the similarities, but also differences. So one thing to flag is that the UN Research Roadmap is very much focused on a global perspective, but also it's focused on a research perspective. And so that's, I think, important. And thank you very much, Claire, for posting it in the chat box, the link to the UN Research Roadmap. For those viewing this afterwards, feel free just to Google or type into your favorite search engine, UN Research Roadmap COVID-19, it'll be the first hit. So in terms of the roadmap, the objectives of it were very much to try to anticipate what would be knowledge needs in later stages of this pandemic when thinking about recovery, but ones that we need to think about right now and answer now in order to ensure we can recover better. And so in thinking of that, that meant not only figuring out what those future needs are, but it meant doing this participatory process to try to get people all rowing in similar directions. Not easy in a virtual world, but made possible because of a lot of goodwill of people who really want to see us seize this moment. And so what's clear is this UN Research Roadmap, it argues, I think, in a singular message around how the socioeconomic recovery that we are going to have to see and the various actions that we are already seeing represents a generational opportunity in order to achieve transformative changes of the kind that we desperately need and we've long known are needed, but which COVID-19 has revealed in a grander way are needed. It served as that grand revealer, ideally achieving those kind of transformational changes in order to get that better and brighter future. And specifically, if I was able to show my slides, it would show this figure highlighting that in this moment, we have a big choice. We can either aim towards a better and brighter future, or we can go back to the status quo. Now, the advantage of the status quo, as it was before this pandemic, is that we already know how to do it. And we know how to do it because we've been there before, and we don't actually need new knowledge and need to figure it out. But the downside of that approach, and this is exactly the figure, thank you for sharing, Claire. The downside of going to that approach is that we know it's not satisfying. We know that our current world order does not actually serve the needs of everyone. It doesn't serve the needs of most people living on this planet. And so it's deeply unsatisfying. It's also not a status quo outcome that will allow us to achieve the 2030 Sustainable Development Goals, which are that unifying framework that all countries in the world signed up for in 2015. The ideal option, of course, is getting for that better future. The challenge, though, is that we don't actually know how to get there. We know lots of things about getting there. We know that there's different areas in which we need action. We know that we do have a lot of knowledge on which to build, but we don't know exactly how to get there because we've never been there before. But that then just highlights that's what research is all about, right? So when we don't have an answer to a question yet, the best way of going about trying to find the answer would be through research. And so that's what this roadmap was all about. Going to the next slide. What's clear then is that in this roadmap, we had an opportunity to highlight, in this case, we highlighted 25 top-level research priorities that we think need to be answered right away, as fast as possible, to inform a better recovery. But we also provided a framework for understanding the challenge and opportunities that lie ahead, as well as science strategies, which I won't discuss today, but which are detailed in the report for those interested. Next slide. Specifically, when thinking of 25 research priorities, it was really hard actually to come up with what are the 25 top things we need to know. I won't go through them today. Take a look at the roadmap if you wanted to hone in on the details. But on the next slide, I will highlight that all 25 priorities emphasize a singular question, which is really about recognizing that there's so much going to happen during this pandemic and immediately after. How do we ensure that we not only achieve direct benefits of those various interventions that are happening, but that we simultaneously achieve co-benefits for equity, resilience, and sustainability? So how do we ensure that if we're acting today, that we're achieving additional benefits, shaping the kind of future that we need? Next slide. And on that next slide, it highlights that we need to be thinking about this in terms of a quadruple bottom line. And what this figure highlights is that, yes, solutions that achieve direct benefits, those are good, but even better would be a solution that also achieves one co-benefit. Even better would be a solution that achieves two co-benefits. But actually, best would be a solution that achieves three co-benefits: equity, resilience, and sustainability. And indeed, as the next slide highlights, I think that it's clear that it's not actually enough just to have two out of three of these elements. For example, if we build back a world that is more equitable and more sustainable, but if it's not also resilient, we know we're going to face future challenges. They will come, and we find ourselves again in a precarious situation. I will now just ask if we can skip through the next few slides, and I'll just go to a last slide in terms of action needed. Exactly. Thank you, Claire. You predicted the previous, exactly. Yep, you predicted what I would need. And just to flag that, of course, this is a roadmap, but as the UN Deputy Secretary General emphasizes, it's just a tool. And ideally, it's meant to inform action in a similar way that the CPHO report led by Dr. Tam was meant to inspire action. In this case, it's a call to action for researchers who, of course, are the ones who would need to tackle these complex research priorities. It's a call to action for research funding agencies who, of course, need to fund it. And it's a call upon governments, civil society organizations, public health leaders in order to ask for, and in fact, demand this kind of research from those who are able to do it. And ideally, to try to institutionalize the use of research evidence into their and your processes as much as possible, which in turn creates a virtuous cycle that would allow us to get to a better future. So with that, I will conclude, and just a big thank you again to the Collaborating Center for leading this seminar, and thanks to all the partners who made this possible. This really was a Team Canada effort.
Yeah, thank you, Stephen. And you know, I learned a long time ago that there's tremendous wisdom in those that can actually distill huge, complex things into, you know, one sentence or two. And you did that. You and your team did that. So thank you for doing that. And thank you for giving us that, I love metaphors as well, giving us that picture of the three-legged stool, right? Because the three-legged stool is a very sturdy and useful tool and instrument. But if one of those legs is out of balance or one of those legs is broken, as your illustration shows us, it's no longer able to be used. So thanks for that. And that's a very succinct and I think great platform for our conversation.